Good morning. This is a very interesting video, so don't miss this out, please. I get this question all the time. I never had that before. How come I didn't know about it? Uh, and my answer is, well, there's always first time for everything, and most of the problems usually are silent until it gets to a certain stage and when you start feeling it. Um, so most of the common problem medical condition, they don't warn you. The disease itself is there, but it does not give you any symptoms or signs, you know, that they're present in your body until it's too late. Or sometimes it's too late, sometimes it's not. Sometimes you have some symptoms. So if you're lucky that you get symptoms, like for example, you start having headache, then you realize, oh, maybe there's a blood pressure issue. Blood pressure, if you find out blood pressure is high, or sometimes you have symptoms of diabetes, but many times there is none, right? So I'm going to talk about the common medical condition and how they're silent, and sometimes you find out because you have catastrophic events in your life. So high blood pressure is number one. So I'm going to break it down as silent killers. High blood pressure, hypertension is number one. It's silent. It causes no pain, no symptoms until complications like stroke, heart attack, kidney failure occur. I had two patients and I had a video about them. They didn't believe in medical care, and they both had a stroke 1 month apart. That's when they found out. Husband is, in a wheelchair. Luckily, wife recovered. She had a smaller stroke, so she ended up taking care of him. So blood pressure, hypertension, that's one of them. So what you can do about it, check blood pressure regularly, at least once a year, if normal. It's a cheap machine you can buy, or you can go to your doctor's office, they can do it. Gotta make sure you have a healthy weight, and you're not consuming excessive amount of salt, and you are active. You're walking every day, at least half an hour, which is the simplest thing you can do. It just requires commitment and discipline. That walk anywhere, it doesn't really matter. It could be mall, it could be anywhere. You need to have those steps in. Stress control, sleeping well, and avoiding alcohol and smoking in excess alcohol, definitely no smoking. High cholesterol, white silent. High LDL and triglycerides, they don't cause any noticeable symptom, but they build plaques in your arteries. What you can do, get a lipid profile every 3 to 5 years, more frequently if you have other risk factor like a family history, or history of somebody having heart attack early in life. Eat fiber-rich food. You got to remember that 30 gram of fiber is your daily dose, and so you got to start with the fiber in the morning, and with some lunch, and definitely dinner. And so adding some greens and vegetables is a great idea. And starting your day with oatmeal or something like that would be good thing to have every day. Avoiding trans fat is really important. Make sure you add omega 3 fats in your meal. And if you need, statin is there, other supplement like red yeast rice, berberine, omega 3 supplement can help as well. Type 2 diabetes, why silent? Sugars remain high for years. Not everybody feel excessive thirst or fatigue or blurry vision. I mean, only 1/3 of the people have those symptoms, 2/3 people don't. So by then, nerves and vessels may already be damaged. What you can do about it, annual fasting glucose, A1C test at age 35 or earlier, if you have family history, or if you have weight issues, controlling carbs and sweet food and drinks, maintaining weight and walking every day is very important. Any kind of exercise, but walking is the simplest and cheapest one, and the most effective actually. Coronary artery disease is silent. Plaque builds up slowly in your heart arteries. Many people feel nothing until a heart attack happens. What you can do, cholesterol checkup, blood pressure checkup, check your family history, and you can do coronary calcium scan if you have a high risk factor. Eat healthy diet and no smoking, manage stress, sleep well, and be active. Chronic kidney disease is silent. Kidney can lose up to 80% of its function before you have any symptoms. Uh, we see stage 3 kidney disease all the time and people don't have any symptom. Like, how come I didn't know about it? Well, if you haven't had any blood test done, then nobody would know about it. Any annual blood creatinine, urine microalbumin test, if you have diabetes, hypertension, or if you use painkillers like ibuprofen or naproxen, a similar medication, staying hydrated, drinking plenty of fluid, and limiting salt and controlling your blood pressure and blood sugar is the way to go. Osteoporosis, why silent? Bone density loss happens quietly. First symptom could be a fracture of your spine or some bones in the hips. So getting bone density scan, DEXA scan after menopause or age 65, or earlier if you have risk factor. Make sure you're taking calcium, vitamin D, and you're doing weight-bearing exercise. Fatty liver disease is silent. Fat accumulates in the liver without symptoms until inflammation and cirrhosis happens. So periodic checkup, liver enzyme, ultrasound, maintaining healthy weight, low sugar diet, and exercise, limiting alcohol. So the common theme is that holistic life you have to live to be healthy, which that means you have to really sacrifice some of the things which give people instant satisfaction, gratification. It's like I hear from people in general in clinic, I love sweet. Well, yeah, I love sweet too, but I choose not to because it's not good for you. Who doesn't love sweet? Of course, it tastes great. By the time it goes in your gut, it's not great though. So you have to think beyond your instant gratification. Certain cancer, colon cancer, often silent until bleeding or obstruction. You got to start colonoscopy from age 45 or earlier if your family history. Cervical cancer, no early symptoms, pap smear every 3 years, or HPV test every 5 years. Prostate cancer may not cause any symptoms early. So checking PSA testing and after age 50 and it's really important. Lung cancer, silent until advanced. Low CT, low dose CT scan for smokers age 50 to 80 can be helpful in detecting early cancer. Sleep apnea, why it's silent? Often unnoticed. Person may just feel tired and have snoring noticed by others, but oxygen drops strain your heart and brain, and your chronic elevated level of cortisol, and you develop insulin resistance, and all these issues start happening. So getting evaluated if you snore, you feel tired, and you have high blood pressure. Weight loss, oral or CPAP therapy can be life-saving. Atrial fibrillation is silent. Irregular heart rhythm could be silent. Not everybody feel palpitation. They don't have symptom, but stroke risk is 5 times more. So getting EKG done, especially after 60 every year, managing thyroid, blood pressure, and limiting alcohol or caffeine, and having a healthy sleep is a good way to go. Sleep apnea and atrial fibrillation is interconnected because of dysaturation of myocardium. Key takeaway: silence does not mean safety. It means you must be proactive. Annual physical checkup, blood pressure, sugar, cholesterol screening, basic metabolic panel, kidney, liver test, cancer screening based on your age and risk. Maintain healthy lifestyle, weight, diet, exercise, sleep, and stress control. So thank you for watching again, and I appreciate each and every one of you for watching my video and being so interactive and asking questions. So I try to do my best. Sometimes I may not just give you the complete answer, but I try my best. Thank you.